Anti-cancer vaccine Gardasil, which protects against human papillomavirus, has been recommended by the federal government for girls and boys aged 11 to 12 years. The National Agency for Food Administration and Control says the vaccine is based on the scientific evidence that shows that a single dose can provide solid protection against cervical cancer caused by the virus.
NAFDAC is commencing on 6 regulatory measure approaches to address the situation. These include immediate inclusion and implementation as a matter of urgency of NAFDAC good manufacturing practices, good hygienic practices, and laboratory testings such as mycotoxin testing or level of mycotoxin testing, pesticide residue testing, and heavy metals. And all this needs certification for all our regulated products, be it food, drug, and others by the National Export Supervision Scheme.
Mojisola Adeyeye, DG NAFDAC there. Well, the Director General of the Africa Center for Disease Control and Prevention is with us in the studio here. Dr. Jean Kaseya is on his first official visit to Nigeria and has met with Minister of Health Mohammed Ali Pate. Well, the regional body is seeking to address health challenges in the continent and discuss prospects for establishing vaccine manufacturing in the country. Thank you so much for joining us on Newsnight tonight. First, give us an idea of what you're in Nigeria for. What's, the purpose of your visit, and what are you learning so far?
I'm so impressed in Nigeria. You know, I see the way Professor Pate, under the leadership of President Bola Tinubu, is implementing what we call the four-point agenda. And one of these four-point agenda is the health security. Another one, we are talking about the medical industrialization. It means the local manufacturing of medical products in Nigeria. And Africa CDC, we are supporting this agenda because we believe that we are learning from COVID-19 and we want to be ready for the next pandemic. And what Nigeria is doing is really to get the country and the whole Africa ready for the next pandemic.
For the next pandemic?
Yes. The question is not if we'll have the next pandemic, the question is when we'll have the next pandemic.
So, well, as we know that there's an assurance that there's a certainty, not assurance, a certainty that there's a pandemic coming. But again, quickly, how prepared is Africa? We're looking, for instance, looking at the cancer vaccine, which the DG of Nigeria's NAFDAC, drug agency spoke about. And we also saw the level of, good in terms of survival rate during the COVID around the continent. It brings us to looking at some of the key things that scientists will be doing. Are there things that you and your colleagues have started looking to gifting Africa to be pretty much prepared should there be another pandemic?
Yes, we are working in a number of areas to make the continent ready for the next pandemic. You know, when we are talking about the next pandemic, it doesn't mean that we don't have any outbreaks. No. Let me share with you that Africa, we have 2 new outbreaks per week. It means anytime we can have a pandemic. Weekly. 2 new outbreaks per week. In Africa CDC, my colleagues are not sleeping. And we need to respond to outbreaks almost every day. We still have cholera killing people. You know, cholera is a climate change related disease. Cholera affected 16 countries in Africa, killing more than 4,000 people. But let us talk about the pandemic, because people are so afraid about pandemic, they forget. Even in Nigeria, we have the diphtheria, you know.
Right.
And
Still ongoing.
in November, we have to be ready for the Lassa fever. It's an outbreak. We are talking about it. For us to be ready for the next pandemic, we need to make sure that we have appropriate human resources. This is the first point. The second one, we need to make sure that we have the lab in place. Before COVID, only 2 countries were ready with a perfect lab system. Today, with Africa CDC, we have 39 countries. And we are so glad that Nigeria is one of the countries pushing the whole continent. We need also to think about availability of medicines and vaccines.
Right.
My sister, the DG of NAFDAC, I met her this morning. I will meet her tomorrow before flying. We are discussing how to strengthen the regulatory process in Nigeria. This is so important. We need to have a strong NAFDAC to ensure that all products manufactured in Nigeria or imported to Nigeria are safe. And we have another component that is also critical for us. The whole process, what we call I was meeting in Nigeria CDC today, the coordination mechanism, how to make sure that if you have an outbreak in one of the states in Nigeria, they get information on a timely mode, they analyze and they share information. You know, it's a broad component and we have to put pieces together. And this one, I say, let me go visit Nigeria and learn from Nigeria and also bring some other experiences also to share with Nigeria.
So what are those experiences that you're bringing to share with Nigeria, especially with the this plan to make Nigeria a hub, you know, for vaccines and even export vaccines? What are you bringing to the table as far as that's concerned?
We are bringing a number of ideas. Let me share with you something important. When we are talking about outbreaks, we are living with outbreaks in Africa. I was meeting 2 days ago in Berlin, a number of people, and there is a minister of Malawi who was asking publicly, do we have the same definition of outbreak? Because we are living with some diseases. Look, in Nigeria, we have malaria. We are living for malaria. But 0 mosquito net manufactured in Nigeria. This one is not acceptable. I think today we had a nice discussion with colleagues. We are moving towards manufacturing mosquito nets in Nigeria for Nigerians and Africans. This one is important. What we also bring is the way other countries, they approach the health security. We say we are able to come to share with you, and you can just see if this is something you can consider in Nigeria. We know this is what we are doing, what we are sharing. Yeah.
Let me quickly come in here because you're one of Africa's finest scientists, and you have a lot of other brilliant colleagues. And you also spoke about manpower. We've lost some of them to Europe and America.
Yes.
But again, coming back home here now, 54 African countries can do this together. But till this moment, we're still talking about the Serum Institute in India. So how can we harness the potential on the continent to bring back vaccine manufacturing here?
When we talk about vaccine manufacturing, this is, you are comparing with Serum Institute of India. Let me tell you that I'm one of the people who supported Serum Institute of India long time ago. I think it was in 2009 when I managed to lead a team that not discovered but manufactured the meningitis A vaccine, and we supported India and Serum Institute of India to grow. Today, to bring the manufacturing of vaccine in Africa, we need the tech transfer technology. And that one, Africa CDC is working on that. We are facilitating the process. The second one, we need funding, because you cannot manufacture a vaccine if you don't invest. And we are bringing private sector to work with the public sector, and we need private sector to be secured. And we are discussing with the government of Nigeria, with Minister Pate, on how we can do that. The third one is, what is the market? Because when you manufacture, you don't manufacture just for yourself, you manufacture for Africa. And for that, we need a strong regulatory process. Today, NAFDAC is what we call the maturity level 3. How to increase that to become maturity level 4, and to bypass some of the limitations that we have, like what we call the WHO pre-qualification. Because you can manufacture your vaccine, if you don't have the WHO pre-qualification, no one will buy it. You know, this is what we are doing to enabling environment and to ensure that the local manufacturing can be a reality in Africa.
Fantastic.
1% of vaccines we are using in Africa, only 1% is manufactured in Africa. It means we are importing 99% of our vaccines. And we don't want to be exposed if there is another pandemic.
That in itself is some health, insecurity there. But very quickly, you said you've been discussing with the president on Nigeria's health sector. The budget, the national budget of Nigeria for health has, usually hovered around 5%. Is that something you're looking at? I mean, the Abuja Declaration of 2001 recommends about 15%. What are you saying about the budgetary allocation for health?
One of the key messages that came from Professor Pate after discussing with the president was Nigeria will increase domestic financing for health. This is a great message. Today I was discussing with the minister and some senior colleagues to say that we need to start to invest in our health systems. If we start to invest in our health system, what could other partners will give us, it will be to complement what we are doing. And there is no way for us to be sustainable in what we are doing if we don't invest. And I really applaud the president and the minister for taking this initiative to increase. And we are discussing on more practical way how we can support Nigeria for that.
Thank you so much. I guess that's a good place to say thank you very much. Dr. Jean Kaseya is the DG, Director General of Africa CDC, on his first official visit. I hope you're enjoying your visit so far. Thank you so much for joining us.